Hello friends, this is Dr. Bhavdeep Ahuja here. I'm really happy to see the reaction and your love to my YouTube channel. So today's small video is about again a query that I received which I promised to get back in the form of a video. So the query was that kindly guide how to deal with government officials like a police wala specifically. They enter freely and expect VIP treatment and that too free. So, how to deal with such a situation? I'm sure that many of us must have received this or must have faced this kind of situation. So, before I answer this, there is one golden rule that I follow and that I urge all of you to follow. The good dental care or the good dental treatment that you offer is the right of every patient, irrespective of the socio-economic background that he or she comes from. So we don't need to actually look into the money factor firstly before rendering about the care part. The care, even if it is a middle crown, even it is a zirconia crown, the care factor has to be the same. Of course, we do accord some more care to our VIP patients, and sometimes we cross the line and make our regular patients suffer. So, what exactly I will advise is that VIP patients, whatever I have encountered, yes, leaving aside the police walas or maybe a couple of such public servants, I usually find them not demanding anything specific but a good care being taken of. Obviously, they will have their time restraints sometimes. They might want us to adjust times, but I rarely come across certain VIPs who will actually not want to pay. Everybody who knows about dentist or dentistry even a little bit knows that the treatments are expensive, and if they are not going to pay, the doctor is not going to give them good care because nothing comes free of cost. There are no free lunches available anywhere or everywhere. uh, so we need to take care this part. So the only thing is that if it is a government official of or it is a VIP who's come to you, that person should be taken care of. And obviously, if when he comes for the first or the second time, you actually spend some time in with him in the consultation as well. There will be no shortcuts that you actually workflow or the SOPs that you follow for your routine patients are to be followed. It has to be history taking, it has to be your consultation, it has to be the consent form signing. Those things should not be given a say skip at any cost, come what may. And you need to put that point very very firmly. And once you are very firm on a few things before the start, trust me, you will be able to handle that VIP better. Because once you go into all this history taking, treatment planning, consent, consultation part, obviously the last stage maybe or the second last stage maybe the point of costing will come about. And when we actually try to dodge that point, that is the say our shortest skipping point, if I can say. We try to skip over that कि हम इनसे कैसे मांग सकते हैं. Why not? It is our clinic, it is our treatment, it is our time which we have to do or we have to handle. So you don't do about that part. So the first mistake you don't have to do is the that and we usually do is, don't take a shortcut. The same protocol, the same SOP is to be followed for everyone, even it is a police wala. So the second thing is that sometimes what we do is, sometimes we make a mistake that we try to do some little bit of treatment and then call them next time, और दवाई लिख देते हैं कि चलो आ जाओ this time. You sometimes we sometimes feel that चलो कोई नहीं, इस बार तो टरकाओ, अगली बार देखेंगे. And we feel that actually we are trying to fool a patient. Trust me, I won't be boasting, but I have treated the member parliament of Ludhiana, my town. He has been my patient in the past. And there is a close colony very close to my house known as the police colony, in which the residents are living over there. And trust me, those residents are not very, very highly paid. Obviously, I'm not talking about the inspector level, maybe a little bit lesser than that. All those guys reside in this police colony. And trust me, they have been my patients from day one in that colony. I get a good chunk of my practice from that colony, and never ever any police wala has actually tried to skip that point of paying money. It is only our fears that we don't ask money from them, and that is where we falter. इनसे कैसे ले सकते हैं, कल को काम पड़ गया थाने में तो. So that is the thing actually comes to our mind. If they have to, we have to charge for our services. They only want good treatment. They will never want a shortcut in the treatment being rendered to them. The problem is that we consider the VIPs as a pain in you know what. You can pick your anatomic location as per your wish. So the problem is that we do have to make certain adjustments sometimes in terms of timing especially, or in terms of attending to them at an odd hour. That adjustment if you can make, well and good, but if not, you are not ready to make that adjustment, kindly do specify the same at the time of first consultation. Most of these visits can actually become sweet or sour at the first consultation itself. The VIP can decide, नहीं यार ये डॉक्टर एडजस्ट नहीं करेगा, ये मेरे टाइप का है ही नहीं है. He'll walk off, he'll never come back to you. You want that VIP ट्रीट भी करना है, उसको खुश भी करना है, और अपने असूल भी नहीं तोड़ने हैं. It is not sometimes say possible to get best of the both the worlds. So we need to understand that you win some, you lose some, and once you are fixed on your principles that you follow in your clinic as a rule for every patient, be it the time part, be it the money part, be it the adjustment or the follow-up of the instructions part, or the consent part, or the treatment planning, or the diagnosis part, trust me, you will never ever feel awkward. The only thing is that it is all in the mind that we want to treat them differently. They never want a different treatment. They want the same good amount of care that you are offering to other patients. So next time when such a person walks into your practice, never ever treat them differently. A good dental care, again I will repeat at the cost of repetition, I will say once again, a good dental care is the right of every patient that walks into your practice. It is not only for the VIPs, it is for the common man or the common patient as well in your case. So thank you so much. I hope I have answered the query in depth. So if there are any more queries, please do message me. I'll try to make a video in that format. A lot of webinars coming your way from 2nd of May, Sunday, 2nd of May onwards. Every alternate day you'll get a video on YouTube, and I'll be on a break for short videos. Obviously I'll be making them, but those will be then uploaded after 15th of June. So thank you so much. Take care. Bye bye. Have a great day.